Good morning, everyone, and thank you for joining us today. Teresa is on site at Leamington Vaccination Clinic and is not here for the YouTube session. I will now report our daily case counts. We have a total of 13,200 cases to date, an increase of 51 cases from yesterday. Of the 51 new cases, 21 are outbreak related, 10 are close contacts of confirmed cases, 3 are community acquired, and 17 are still being investigated. 262 cases are active, 12,545 cases have resolved. In total, 393 people have lost their lives as a result of COVID. 38 cases are hospitalized, 11 cases are in ICU. There are 13 active outbreaks across Windsor-Essex, 5 workplaces, 3 community outbreaks, 2 retirement homes, 2 school outbreaks, and 1 hospital outbreak. Today I want to report an update on the vaccine rollout for our community, and I have a PowerPoint slide deck for that. So giving a quick overview of the phases of vaccine rollout, and by the province, as we know that the vaccines are being rolled out in three different phases. Phase 1 targets the high-risk population. In Windsor-Essex, it started on December 14, 2020, with the limited supply of the vaccine that was aimed to target the high-risk population in the long-term care home, retirement home, healthcare workers who were directly working on COVID response. And then phase 2 was linked with the mass vaccination clinic that was expected to start March-April 2021. Significant and steady increase in vaccine supply, which we have started to see, and with regular supply of vaccine that are coming our way. And in preparation of that, we already have the 2 targeted vaccination clinic that is set up, one in Windsor and one in Leamington, and on top of what the initial clinic that was started and run by Windsor Regional Hospital. And then eventually we'll move forward to the phase 3, which is the steady state, and then hopefully by then we'll have most of the people who are interested in getting the vaccine should have received the vaccine by then. So overall, when we are looking at what was covered by the province in the phase 1, and as we can see, the province is reporting in Ontario that most of these long-term care home, retirement home residents are substantially completed, and the retirement home are underway, and the caregivers are still ongoing, and then staff and frontline workers are ongoing. Overall, 820,000 doses have been administered, while majority of the doses have went to some of the other priorities. When we are looking at what has happened in Windsor-Essex, we are way ahead of many of the provincial priorities and provincial rollout of the vaccines. We have already covered all the long-term care home and retirement home residents, staff, and essential caregivers with more than 90% coverage in all of these areas. There are some ongoing maintenance that's going on, so there may be odd people who may have not received their vaccine, but the majority of them, they have received it, and there is a maintenance plan underway to make sure that any new transfers, any new people, they're getting the vaccine as well. Along the same lines, the highest priority healthcare worker, based on the guidance, they are already almost completed as well, with the exception of few. And again, those are the maintenance issues that will be ongoing, but the majority of them are already completed. And then we're looking at the other congregate care staff that is also completed as well, which is what we have provided. We have the Indigenous population that is ongoing. These are all the phase 1 priority population. The adults recipients of chronic home care, this is started and it's currently ongoing. The medical first responder, EMS, fire, police, that they are completed. And again, these are not everyone. These are the people who are involved in the medical first response. Right now, the very high priority healthcare worker, their vaccination is ongoing, and in addition, the adult 80 years and older, that's ongoing. So that's pretty significant coverage that we have done so far in our community. As an immediate priority right now, we hope to continue our maintenance for the long-term care home, retirement home residents, staff, and essential caregivers. We want to complete all the adults recipients of chronic home care in a timely manner. We want to complete the very high priority healthcare worker that is currently ongoing and complete the 80+ adults in the community, and then also launch our mobile clinics for priority population in certain neighborhoods. So right now, from the vaccine clinic and coverage perspective, we have the hospital hub that's run by Windsor Regional Hospital, St. Clair, at the St. Clair College, vaccinating on an average of 600 vaccines a day. We have a targeted clinic for the 80+ population at WFCU for this week. Right now it's 330 vaccines per day, and the goal is to take it all the way up to 450 or more, with finding more efficiency and but not compromising on the quality of service that we are providing to these seniors. Similarly, targeted clinic at the Nature Fresh Farm that is open today. We hope to vaccinate 160 vaccines per day initially, and ramp it up to the level that would allow us to make sure that the vaccines are coming in steady and then are being rolled out through all of these channels. If we just quickly look at all of these numbers, so we are looking at roughly vaccinating 1,000 vaccines a day, and we are right now getting close to 4,000 vaccines per week for our region, and that is expected to increase. So the vaccine supply that is coming down to us and the vaccine that is being distributed through all these hubs, it's almost balances out, and at the end of the week, we potentially will have no vaccines, and we'll have to wait for the rest of the vaccine to come in our way. The upcoming priorities, as soon as we complete that, we'll have to obviously do an ongoing maintenance of the previous priority. We want to make sure that all the high priority healthcare workers, so right now the highest priority is completed. We are doing the very high priority, and then we'll move on to the high priority healthcare workers. We'd also be looking at 75+ population as soon as we finish our 80+ population, and then we also know that Windsor-Essex is one of the chosen site for the pharmacy rollout, and through that pharmacy, adults between the ages of 60 and 64 years of age will be targeted for vaccination through those clinics. And then we have some of these priority population, priority neighborhoods that we will be targeting, and we'll continue to ramp up our WFCU and the Nature Fresh Farm Recreation Center vaccine clinic based on the supply of the vaccine, and also continue to support the vaccine clinic that is run by the local pharmacy and primary care provider. And on top of that, we also have to identify the phase 2 priority, because we are almost getting into the phase 2 priority right now, and the scheduling clinic based on the projected vaccine availability. So among the individuals who would be included in the phase 2 priority is seniors aged 60 to 79, and then high-risk congregate settings such as shelters, community living, residents of all those places, and then individuals with high-risk chronic conditions and their caregivers. And also among the big other group is workers who cannot work from home, and then the at-risk population. So distribution will continue to happen for these priority population by WFCU site, Nature Fresh Farms and Recreation Center, pharmacies, primary care, site-specific location, and mobile teams. So all of these will be employed to get to the phase 2 priority population as we continue to ramp it up in the next coming weeks. And this is just a list of the chronic conditions that people will be under to receive the vaccine. And they are classified into highest risk, high risk, and at risk. And there are a number of chronic conditions that are identified. So we'll be working with our primary care providers as well as our physicians in the community to make sure that all these individuals are identified and will be prioritized for vaccination as soon as we launch our phase 2 vaccine. And this is a list for people who cannot work from home, and there are a number of priority groups, including various groups that are currently ongoing working on without the ability to work from home, and they will be prioritized for the vaccination in the phase 2 as well. So a very quick look on some of the vaccine that we have right now, and as we know, Pfizer was authorized by Health Canada December 9th, Moderna authorized by Health Canada on December 23rd, and AstraZeneca February 26th, and then Janssen on March 5th. So all of these vaccines use different way that how they produce the immune response in the body. Pfizer and Moderna, they are both messenger RNA-based vaccine, and these vaccines, the way it works, the messenger RNA enters the cytoplasm of the cells and provide instructions to produce the spike protein antigen that attaches to the cell surface. So that's what it happens. It mimics the role of the spike protein that we typically see in the SARS-CoV-2 virus, and that triggers an immune response from the body. And then it doesn't enter the nucleus of the cell or alter the human DNA in any shape or form, as has been raised as a concern by some. And then the other sets of vaccine is the AstraZeneca and the Janssen, which are the non-replicating viral vectors. So this is the harmless virus that is dead and used as a delivery system. And what it delivers, it delivers the same spike protein, which then triggers an immune response. So this is more of the typical vaccine that we see for flu, for influenza, and for any other type of viruses. So that it uses the same technology. All these vaccines are administered intramuscularly. The Pfizer, Moderna, and AstraZeneca, they all require 2 doses, and Janssen only requires 1 dose. The duration of these vaccines are currently being reviewed, and the National Advisory Committee on Immunization recommends delaying the 2nd dose of vaccine up to 4 months where needed to ensure that the maximum number of people receive their first doses. So this is currently being reviewed by the Ministry of Health in Ontario, and we will hear more from the ministry in terms of the interval increase for these vaccines. The good or the bad part of this interval is the first dose for any vaccine. When individuals are getting the first vaccine, it generates that immune response. It triggers the immune response so the body can be prepared to generate that immune response when they identify a new virus entering the body. The 2nd dose generally prolongs the duration of immunity. How long these immunity lasts, we know from various data that even with the infection from SARS-CoV-2 virus, the immunity can last anywhere between 3 to 6 months. So delaying the vaccine doses, it basically just prolongs the immunity for a longer period. So that's the rationale and hypothesis that's given behind the recommendation by the National Advisory Committee on Immunization. So in terms of the effectiveness of these vaccines only after giving 1 dose, Pfizer vaccine is estimated efficacy is 92.3% with more than 14 days after dose 1, but before dose 2. So even when individuals are getting first dose after 14 days, the effectiveness is pretty high. Moderna, similar effectiveness. AstraZeneca, it was estimated 71% after 21 days after dose 1. And then both these vaccines are necessary to promote the sustained immunity to COVID-19 and basically just prolongs the immunity that the individual will be protected. So some of these question that is being raised, that given the differences between effectiveness, is it worthwhile to wait for Pfizer or Moderna, or should people get AstraZeneca or a Janssen vaccine? At this time, and we've said this before, all 4 vaccines are effective at preventing severe symptomatic infection with COVID-19. The AstraZeneca and Janssen vaccines are highly effective at preventing hospitalization and death from COVID-19, and this has been shared as a result of clinical trial and all those data that we have available right now. Even 1 dose of AstraZeneca can lower the risk of a COVID-19 infection leading to hospitalization. And right now, our best way to prevent COVID-19 infection and hospitalization in Canada to increase population immunity. When more and more people are immune, more and more people are vaccinated, the virus cannot continue to have this ongoing sustained transmission. And the more and more people will receive the vaccine, it will prevent that. AstraZeneca currently is not recommended for an individual 65 years of age or older due to limited evidence, but for the rest of the population group, they are eligible and they should be able to receive the vaccine. So in summary, Windsor-Essex is way ahead of many regions in rolling out vaccine on a per capita basis. And just to look at some of these numbers that we have for these vaccines, we have currently vaccinated 4.74% of our population that have received at least 1 dose, and this is the highest in the province that has covered based on the per capita basis. We have provided almost 2.73% of the population with both the doses of the vaccine. So we are way ahead of the many regions in the province. We are getting the COVID-19 vaccines at a steady rate. There's a typo in my slide, so I apologize for that. A steady rate through a strong partnership between Windsor Regional Hospital, Windsor-Essex County Health Unit, City of Windsor, Town of Leamington, and many other municipalities that are involved in the vaccine rollout. So this is being worked at with a lot of logistical challenges that all of us are working together to make it as smooth as possible for our residents in our area. Windsor-Essex being one of the community that is identified for the vaccine rollout. So you will see a lot more vaccine coming to our region and a lot more AstraZeneca coming to our region that will be rolled out through the pharmacy in the coming weeks. The vaccine rollout will ramp up in the coming weeks with large shipments of vaccine coming to our region. So right now we are getting roughly around 4,000 vaccine, but we are anticipating by the end of this month, we will be receiving more than 12,000, 13,000 doses of vaccine in our region. So that would triple the supply for our vaccine. And that's why we wanted to make sure that we have all these delivery channels up and running for our community to give the level of protection that our community needs. Thank you.
We'll now take questions from the media. Today we'll start with AMA 100.
Dr. Ahmed, I had a lot of questions after that presentation, but I guess maybe first off, right off the bat, you mentioned today 21 cases are due to outbreaks. Is that outbreaks within the homeless population, within our schools? Any additional information there?
Rob, I have to wait for my team to compile all that information and present that to me, and maybe we can share that information later. I don't have the breakdown of where these 21 cases are. We typically have our outbreak meeting right after this, so I will be able to share that information later.
Okay, thank you. And just looking here at the website, I noticed there's a new section for the variants. One has been confirmed for the United Kingdom, but it looks like we are dealing with about 27 cases right now for the variant. With that number, obviously concerning for you and the team?
Absolutely, and we have said this before that we know the variants of concern spread very quickly, and we are seeing an increase in the spread of variants of concern throughout the province, and our region is also experiencing the same, and that's why it's still absolutely important for us to ensure that all these precautions are being followed. There are certain changes in how the case and contact management are done based on these variants of concerns. So a lot of things happening on that spread front, and we wanted to make sure that we are putting out this information as transparently as possible. We committed that once we get the confirmation, we'll report that. So that's reported on an ongoing basis. We will continue to report the variant of concern on our website so everyone can see a track of what's happening. And if we link any of these outbreaks with the variant of concerns, you will see that we will identify that the outbreaks is associated with the variant of concern, or is it just the isolated case.
And then one final question about the presentation. I might have more after, but I'll let my colleagues ask some questions as well here. But when it comes to the percentage you mentioned, I believe I wrote it down right, 4.7%. I know the vaccination process began in the beginning of January with the long-term care and retirement homes. I guess for the past 3 months, a lot of effort has gone to the vaccination. With that number right now, are you pleased with the direction we're heading?
Well, I think I expected to see more, but it's a function of how much vaccine we are getting. So the purpose of giving that number and without giving more details on what exactly is happening in the other regions, I'm sure that the province will share all of that information later. But we know that our vaccination rates are pretty high, and we will continue to work with our strong partnership with all our partners, our municipalities, our hospitals, our healthcare partners. We will continue to roll out the vaccine. We want to provide the level of protection to our community as quickly and as best as possible. We can do better, but at least knowing that we are ahead of the many other regions in the province, that gives me a little bit more comfort, but we'll continue to expedite the vaccine and give the level of protection to our community.
Thank you.
Any questions from CTV?
Yes, hi, good morning. I was just wondering, with the Leamington vaccination clinic now open, what is the process of how a registrant clinic is assigned and determined? We've heard from a couple of people who were contacted to go to Leamington, even though they live much closer to the WSCU center and may not have the means to get to Leamington.
Well, right now it's all a function of the capacity as well. We have limited vaccine appointment at the Windsor site, and we have more opening and more capacity at the Leamington site. When an individual name is picked, they are they are given that option wherever the option is available, depending on when they're selected. We try our best to provide a good match to someone who can be prioritized without causing any undue hardship, but sometimes it's just difficult and it's not possible, so they are offered the option to go to wherever the vaccine is available. We hope that when more vaccines are available, it wouldn't be an issue, but at this time with the limited supply, I can see that as a challenge, and I can see maybe some people may not like that, but that's the only option at this time. They can choose to decline it, but then they'll have to be reprioritized to go to the closer location when it comes up. But our goal is to provide that level of access to everyone in a timely manner, rather than delaying for those when we have the openings available in Leamington.
Thank you.
Any questions from CBC?
Hi, yes, good morning. I wanted to ask a little bit more about the variants of concern. We heard about the first couple of cases. I'm wondering, when did the last 25 or so come about? Is that relatively recent?
I would say that it's almost in the last 7 to 10 days. We have seen some transmission linked with that as well, but those are all contained. And some of them, when it's linked to an exposure, it's reported as such for the exposure related to variant of concern. But some of the spread that we are seeing is in the family of the individuals who initially got the case.
Okay, thank you. I also have a question regarding volunteers. You were seeking for vaccination sites. I know that the health unit was seeking interest from healthcare workers. Are you taking student volunteers as well?
Yes, we are. Again, it all depends on some students, like the medical students, the nursing students, and all those people who are able to do the injection, especially because our health unit is dealing more on the health side of the things. And so we are, and we will be working closely with the hospitals, with the universities and the colleges to make sure that they are, ready to vaccinate under the requirements for their respective college and universities.
Thank you.
Any questions from Blackburn?
Yes, good morning. Dr. Ahmed, you mentioned about you're still waiting on direction from the province about delaying that second dose. At this point, are you still booking appointments for second doses, or are you waiting to hear from the province?
Well, we have been told that when we are given the direction, then we can. So even when we are booking the appointment, we may have to delay that right now, unless I see something in writing. So people may still get the second dose appointment, but they may be asked to defer it or delay it based on the new guidelines.
So are you keeping back second doses at this point, or you're just continually giving out vaccines, expecting the shipments to be regular at this point?
Not for Pfizer. We have been given the direction to use the vaccine as much as possible for Pfizer without holding the second dose. For Moderna, the supply is still limited, so there is some back and forth, and I haven't given a clear direction that whether we can hold Moderna or not. But that's, again, it's a moot point at this time because we only got 2 initial shipment of Moderna. We are expecting some additional shipment of Moderna end of this month, but when it comes, we may see whether the direction is applicable for Moderna too, and at that time, I anticipate that they may not ask us to hold any doses back, but at this time, Moderna, they want us to make sure that we have the second dose before we start vaccinating the first one and continue to give out the second dose. There are some residents, essential caregivers in these facilities that are waiting for the second dose, and those are the priority at this time.
Thank you.
Any questions from the Windsor Star?
Dr. Ahmed, what more can you tell us about the vaccine rollout at the pharmacies? Do we know at this point how many local pharmacies will be equipped with the AstraZeneca vaccine?
So you will hear directly from the province because the province is working with them to have all those plans in place. I can only, because some of them are still in the phase of signing their contract, so I don't want to give out a number, but that will be a lot of pharmacies that we can see. We're not talking about 1 or 2 pharmacies, we're talking about 40 to 50 pharmacies at least, or even more, that will be participating in the program. But right now, they are in the process of signing their contract with the province, and I am sure that the message will come from the province, and we'll make sure that the community is aware of all these where these pharmacies are. We do have to. We want to make sure that our community is aware where these pharmacies are and how they can get their vaccine through these pharmacies. So in the next couple of days or maybe in a week time, you will hear more from us and from the province with the pharmacy rollout. But we can say and confirm that yes, Windsor-Essex region, and I have a tentative list of the pharmacy as well, but as I said, they are all in the process of getting their contracts finalized.
In terms of pre-registration for vaccines at those pharmacies, will it be by the same means as the vaccination clinics where there's an online portal at the Windsor Health Unit website, or do you anticipate there will be a different means of registering?
There will definitely be a different means of registering with these pharmacies, and the pharmacies will be responsible to register their people and to offer these vaccines. And some of these details is currently being worked out, but it will not be through us, it will be directly through the pharmacy.
And just a question regarding your presentation at the end, you mentioned you anticipate by the end of the month we'll be at 12,000 to 13,000 doses. That's per week, that figure?
Per week, yes.
Thank you.
Any further questions from AM 800?
Dr. Ahmed, in your presentation, you mentioned police and emergency services, fire. It's not everyone on the forces, right, as of now? Like you mentioned, just looking for clarification there.
Yes, absolutely. So these are the individuals we have asked the fire and the police to provide us the name of their staff who are providing the medical response or engaged in the medical response. So these are those people. It's not someone who is sitting in the office. These would be all for the people who are involved in that. And again, those are the lists that we expect from these agencies to provide. When we get the list, we pass it on for the vaccination.
Thank you. I know Teresa usually answers this, but I'll throw it out just in case you have the answer. Just any idea how the inspection blitz went this weekend?
You're right, Teresa gives out that answer, but I haven't seen that coming through to both Teresa or myself today, but maybe it will be coming out as a joint release by the province, because typically that's what they have done in the past, especially when it's like a campaign. They come out with more specific messaging in terms of what it resulted and how many charges were laid. I haven't seen that coming our way, so we may have to wait for a couple of days before we get that number.
Thank you.
Any further questions from CTV?
No, thank you.
Any further questions from CBC?
No, thanks.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Nothing further. Thank you.
Thank you, everyone. Have a good day.
Thank you.